On Sunday, President Kennedy made the case for health care for the aged through Social Security at a televised rally at Madison Square Garden. The president advocated passage of the King-Anderson bill to a crowd of 17,500 inside the garden and 2,500 outside, most of them senior citizens.
All the great revolutionary movements of the Franklin Roosevelt administration in the 30s we now take for granted. But I refuse to see us live on the accomplishments of another generation, because what we are now talking about in our children's day will seem to be the ordinary business of government.
The president countered arguments by the American Medical Association, which is opposed to the bill.
Well, let's hear what some people say. First, we read that the AMA is against it, and they're entitled to be against it. Though I do question how many of those who speak so violently about it have read it. We do not cover doctors' bills here. We do not affect the freedom of choice. You can go to any doctor you want. We talk about his hospital bills, and that's an entirely different matter. And then I read that this bill will sap the individual self-reliance of Americans. I can't imagine anything better to sap someone's self-reliance than to be sick, alone, broke, or to have saved for a lifetime and put it out in a week, 2 weeks, a month, 2 months. I visited twice yesterday and once today, a hospital where doctors labor for a long time to visit my father. It isn't easy. It isn't easy. He can pay his bills, but otherwise I would be. And I'm not as well off as he is.
On Monday, the AMA struck back with its own television program. The association hired 200 stations for the presentation, the first such event in its history. The program was hosted by a Florida surgeon, Dr. Edward Annis, who spoke from an empty Madison Square Garden.
This King-Anderson bill is a cruel hoax and a delusion. It wastefully covers millions who do not need it. It heartlessly ignores millions who do need coverage. It is not true insurance. It will create an enormous and unpredictable burden on every working taxpayer. It offers sharply limited benefits. It will undercut and destroy the wholesome growth of private, voluntary insurance and prepayment health programs for the aged, which offer flexible benefits in the full range of an individual's needs. It will stand between the patient and his doctor. And it will serve as a forerunner of a different system of medicine for all Americans. If our government wants to move toward welfare state medicine, let them tell us so honestly.
At his press conference today, President Kennedy responded to the program and to the adversarial stance of the AMA.
Well, I read the statement, and I gathered they were opposed to it. The thing that, what I thought was remarkable was that the language was so similar to the language which the AMA used when it opposed and successfully defeated a proposal which President Eisenhower sent up a number of years ago to provide for reinsurance of private health schemes. I was on the committee, as a matter of fact, that heard it and supported the legislation. The AMA led the fight against it and defeated it. In addition, the AMA was one of the chief opponents of the Social Security system in the 30s. The words a cruel hoax were used against the Social Security system at that time as they're used today. There isn't anyone in the United States who will not have or who has not already had a case of a parent who is sick for a long period of time with a burden falling very heavily upon either them, on their savings, or upon their children. This bill includes provisions for payment of hospital bills, nursing care, outpatient care. It does not attempt to interfere in any way with the relationship between the doctor and the patient, and we have no plans to provide such legislation. The AMA may not support this bill, but I think the American people will, and I think more and more doctors are supporting it. And those who are opposed to Social Security should oppose this. But those who believe that Social Security has served this country well should support this because it's in that tradition.